We can start, bro. We're live.
Good evening, everyone. Myself Srihari from Kapagam Faculty of Medical Science and Research. I'm currently the Best Zone Coordinator, and it's a privilege for me to serve as a moderator for today's session on behalf of the Indian Medical Association Medical Students Network, Tamil Nadu State Branch. On behalf of the IMA Medical Students Network and Junior Doctors Network, Tamil Nadu State Branch, I extend a very warm welcome to all the respected dignitaries, our esteemed speaker, and all the participants who have joined us for the today's informative seminar. At the beginning, I would like to respectfully acknowledge the constant guidance and encouragement provided by patrons of IMA Tamil Nadu State Branch, Dr. B. Sridhar Sir, State President, Dr. B. Singutwan Sir, IMA Past President, Dr. A.K. Ravikumar Sir, President-elect 2026, Dr. N.R. Tyagarajan Sir, President-elect 2027, Dr. M. Thiravyam Mohan Sir, State General Secretary, Dr. B. Solomon Dea Sir, State Finance Secretary. I would also like to convey my sincere regards to our state leadership team, Dr. R. Annamalai Sir, Chairman, Dr. S. Jamna Rani Ma'am, Co-Chairman, Dr. V. S. Hariharan Sir, Chairman, Dr. Kannan Rajendran Sir, Convener. And a special appreciation to the state team members who constantly support activities of the Medical Students Network, Arnagari Sir, Convener, Ajay Karthik Sir, General Secretary, Bala Hariharan Sir, Co-Convener, and Hariram Sir, Co-Convener. So as we know, today's session is about the nutrition in tuberculosis. So malnutrition and tuberculosis are both the problems considerable in magnitude in most of the underdeveloped regions of the world. So these two problems tend to interact with each other. The tuberculosis mortality rates in different economic groups in community tend to vary inversely with their economic levels. Similarly, nutritional status is significantly lower in the patients with active tuberculosis compared with healthy controls. So malnutrition can lead to secondary immunodeficiency that increases the host's susceptibility to the infection. So in patients with the tuberculosis, it leads to reduction in appetite, nutrition malnutrition, and micronutrient malabsorption and altered metabolism leading to wasting. So to enlighten us, the the nutrition in tuberculosis, indeed, it's a pleasure to have with us Dureraj, a dynamic academic achieved student from Nanda Medical College. So he is a dedicated scholar who relentlessly pursued of excellence and commitment towards meaningful academic achievements serve as a true inspiration to us all. So without further delay, let us begin today's session. I now invite the speaker to kindly deliver his talk and share his valuable insights with us. Over to the speaker.
What happened?
இதை க்ளோஸ் பண்ணிடலாமா? ப்ரோ இது மைக் ஆன் தான் இருக்கா? Hello, can you hear me? Anyone?
Yes.
Yeah, you're audible.
Sorry for network issues. Yeah, I am very happy to present a topic on nutrition management and TB. I am a third year MBBS student. I am Dureraj from Nanda Medical College and Hospital. Not every patient dies due to TB, but due to the disease. Most of them were dying due to the nutrition what they have not taken or requirement is missed. My topic is about nutrition management in TB. The crux of my presentation is to explain the bidirectional relationship between TB and malnutrition, and how to assess the nutritional status in the TB patient, and nutrition requirement in the TB, and how we have to plan the diet chart for the TB patients, and the drug interaction between the food and drug, and what are the programs available to enrich the nutritional support for the TB patients. And the last one is my out of my own interest, the role of gut microbiome in TB recovery. To explain the situation in India, around 3 to 5 lakhs per year were dying due to the TB. In that, we have to say particularly due to undernutrition, there are 27% of the people were dying. To prevent that, we have to know about the nutrition status, what is the changes in nutrition happening in the TB patients. First, to understand that, we can study about the TB and malnutrition, which is a vicious cycle. It is a to say in a simple word that TB and malnutrition is a bidirectional relationship. That is nothing but the TB can cause malnutrition. Malnutrition in turn also causes TB. We can see the pathogenesis. All we know that TB infection is a chronic inflammation due to which there will be an excessive release of cytokines, which will go and activate which will go and bind to the arcuate nucleus and the hypothalamus, which will in turn decreases the appetite and hunger. That is nothing but a increase in catabolism, which in turn leads to micronutrient deficiency, and again it leads to immunity and weakness. Here again, we are going to see the same. Due to malnutrition, there will be decrease in the immunity and increase in the susceptibility to the TB. And there is an increased chance of active TB. And again, the cycle continues. How we can break this cycle? First, we have to assess the nutrition status in the TB patient. We can assess them in 4 ways. First, in a simple way, we can assess through the clinical assessment. And all we know through anthropometry, we can assess, and the dietary assessment. At last, rarely we can go and assess through the biochemistry test. The first one, the clinical assessment. Uh, First, with the patient, we can ask how much weight they are reduced in how much month. That is nothing but a significant weight loss, and if there is any muscle wasting in them and loss of subcutaneous fat, signs of any micronutrient deficiency, we can able to notice on. To make the session interesting, can someone answer the picture? I'm going to put next one. Can someone answer what is this picture, and what is its function or use? Why we will use this instrument? Can someone on the mic and say hello? Hello.
You're audible. You're audible.
Yes. Can someone say what is this instrument or tape used to for?
Shaki's tape.
Yes, absolutely correct. It is in Shaki's tape. We are using this for measuring the mid-diaphragm circumference. The second way how we can assess is through the anthropometry. First, we can assess through the BMI. We all know how to calculate the BMI. That is nothing but weight in kg divided by height in meter square. According to WHO, the BMI under 18.5 is represented as undernutrition. And in another way, mid-arm circumference in men less than 23 and female less than 22 is also taken as undernutrition. This is the classification according to WHO classification. They have classified the BMI. We are more concentrating on the undernutrition. So less than 18.5, it is called, that is 17 to 18.4, it is called grade 1 undernutrition. And 16 to 16.9, it is called as a grade 2, and less than 16 is a grade 3, and extremely underweight is less than 14 BMI. Nutritional status in the through dietary assessment is nothing but, as we know, as the third year MBBS student, we have to know about 24-hour recall method. We will ask the history of what they have ate the day before we are going to ask about the assessment. The next one is biochemical assessment. It is rare, right? We mostly we will find through the clinical assessment or anthropometry. Rarely we more then we will ask the diet history. Around that we can find the result or they are under the under nutrition or not. But rarely we can check the biochemical assessment such as hemoglobin value. If it is a less than 12 gram per deciliter, then we are calling this as a anemia, right? Anemia is also a complication of TB, and serum albumin will be decreased in TB, and since it is a chronic inflammatory condition, there will be increase in acute inflammatory markers like CRP, fibrinogen, ferritin, ESR, etc. Okay, now we can see what is the requirement for them, because however we know that there will be increased requirement for a TB patient. What is that requirement we can see now? First, energy requirement. Normal individual, we need around 24 kilocalorie per kg per day. But the TB patients, they need extra kilocalorie around 13 to 40. That is nothing but 37 kilocalorie per kg per day. This is 25 percentage to 35 percentage more calorie than the normal individual they are required for weight gain. The protein requirement for the normal individual, we know that there is around 1 gram per kg per day. But for the TB patient, there will be increased requirement, right? So they have to take at least 1.2 to 1.5 gram per kg per day. Hidden hunger is nothing but due to it is a chronic inflammatory condition, there will, and as well as they are taking anti-TB drugs. Combined effect will cause the malabsorption of vitamins such as vitamin A, E, and D, which are the fat soluble vitamins. And the other minerals such as iron and zinc and selenium will also be deficient in these patients. See, now we have see how to assess the nutrition status in the TB patient and what is the requirement for them. To combine this, we have to form some diet planning chart, right? I am not going to form any dietary chart. Already the WHO have formed that. According to WHO, they are saying around what their consumption as a food, right? Around 55 to 75 percentage of the food should be a carbohydrate, because it is in hypermetabolic state, they require more energy. So they have to take around 55 to 75 percentage as a carbohydrate, and the protein is around 10 to 15 percentage, and the fat as a 15 to 30 percentage. The important topic is what are the foods they should take? What are the food they should be included in their diet? The first one is there is a three motto. There should be a energy rich food, it should be protein rich, and there should be a vitamin and mineral rich food. The energy rich food such as whole grain cereals, nuts, butter, sunflower oil, etc. The protein, the main source of protein, what we are using is egg, because others we can get protein, but very little much we are getting. The main source of protein is nothing but egg we have to use. At least one egg per day. For TB patient, it is very happy if they are taking more than one egg. Vitamins and mineral rich foods such as green leafy vegetables, fresh fruits, etc. The food that should not be taken or they should avoid those things means the first one is alcohol, because it can damage the liver and it can aggravate the TB condition. Sugary beverages, caffeine, and processed food, etc. Nothing. We have to eat. In simple words, we have to eat a healthy food. This is WHO preferred chart for the South Indian people, because we are eating our food is mostly composed of rice and idli, dosa, etc. Right? So they have prepared a separate diet plan chart for the people who are in the South India. And this chart is for the people who are in the North India because they their consumption will be more among that roti, wheat, etc. So they have prepared separately for us. This is the RDA value for micronutrient, which they should be taken regularly. If there is a deficient, we can add these things in as a supplement along with the food what they are taking. Especially as we have seen already, vitamin A, D, E, all will be deficient in this patient. So we can add as a supplement so that it can easily absorbable in them. See, this is the main problem because most of them were in TB were taking anti-TB drugs. But the drugs itself can decreases the absorption of the nutrients and vitamins, which in turn leads to malnutrition. The first one is the effect of drugs on nutrition. The isoniazid and rifampicin, now it is changed into a rifapentin, right? Um, Isoniazid and rifampicin will decreases the appetite and cause nausea, which in turn reduces the food intake. Rifampicin also it will decreases the fat and vitamin absorption, and isoniazid will cause the deficiency of vitamin B6. In turn, actually, we know that isoniazid will cause neuropathy. It is a side effect of isoniazid. And the hepatotoxic drugs, such as pyrazinamide, will impact the metabolism of the food what we are taking. The effect of nutrition on drug. We have already seen what is the effect of drug on the nutrition. It is vice versa. Again, the effect of nutrition on drug is the food will decreases the absorption of isoniazid and rifampicin. How the isoniazid and rifampicin were decreases the absorption of food, vice versa, it is taking place. It is adding more trouble, right? Okay, the programs, what are the programs available in India and Tamil Nadu for nutritional status of TB patients? Are the main one is a Nikshay Poshan Yojana, where they were giving rupees 500 per month. And in Tamil Nadu, we have 2 to 3 special programs such as Tamil Nadu Nutrition Allowance. They are also giving rupees 500. And in Tamil Nadu, Kasanoi Irapilla Thittam, Kasanoi is nothing but TB. Kasanoi Irapilla Thittam, they are providing food baskets for the severe patients. And in NTEP, they are providing the nutrition assessment and the counseling to the patient, which is very, very important. And Nikshay Mitra, again, the community nutrition support they are providing. Yes, Tamil Nadu, Kasunoi Irapilla Thittam, they are providing food basket which should contain the cereals, millets, pulses, and the vegetable oil, the protein source such as eggs of 30 numbers they have to take for per month. They will provide the nutrition what they have to take per month. This is nothing to, this is a revised national tuberculosis program register for patient receiving the nutritional support. We will assess here, we will mark what they are taking, in which date what they are taking, and we will assess the nutritional status of the patient through this revised chart. See, this is my out of my own interest, the role of gut microbiome in TB recovery. See, the TB recovery is multifactorial, right? Nutrition is required. They have to take a proper treatment. Along with that, if we take gut microbiome rich foods, how it is acting as adjuvant, we can see now. See, the gut microbiome will break down the food what we are taking into short chain fatty acids, which will in turn maintains the integrity of the gut, and it will increases the absorption of the anti-TB drugs what they are taking, and it will act as adjuvant and increases the efficacy of the drug. If there is any dysbiosis in gut microbiome, there will be increased, the gut will become leaky gut, and there will be increased cytokine entering the blood, and there will be a aggregating factor. It acts as aggregating factor, and it will increase the disease progression. Hereafter only we are going to see the chart that is determine the target weight to be achieved. See, we will simply keep this as a reference and check what the weight they have achieved or what they should achieve, and according to that we can modify the diet plan. You can slowly see this is the WHO recommended charts. These are my references. I have took most of the information from PubMed website and the park what we are using today. Thank you so much for this wonderful opportunity. Thank you.
Participants, any doubts? Any doubts? Please ask. So, if there are no doubts, can we go for water thanks? Akash?
Yeah, I think you can go.
Yes, yes, bro.
Can we go with the water thanks?
Yeah.
It's a privilege to deliver the vote of thanks for the session on TB and nutrition, breaking the cycle of malnutrition. I extend my heartfelt gratitude to our state patrons, IMA, for their constant support and guidance, and to our IMA Medical Students Network team for their effort and making this seminar possible and success. A special thanks to the speaker, Mr. Duraraj M. from Nanda Medical College, for his insightful talk on TB and nutrition. A special thanks to the organizing team members for their coordination and efforts. Dusty JS, Parthasarthi S, Akash J, Trishit GS. And a special thanks to Akash H, Yashwant Elumalai from Tech team for their contribution behind the screen. Without your support, your session would not be possible. And thank you for all the participants for your active participation. With that, we come to the conclusion of the today's session. Thank you all. Thank you all for your active participation. Thank you.
So can we end this team, bro? Yashwant, bro?
முடிச்சுக்கோங்க.
Yashwant bro, thank you. Thank you so much.
எதுக்கு? Thank you all so much. All
This
did a
seminar,
really good
3
job.
days, you are so supportive. Thank you so much. Ended well.
Definitely. Always. Very, very good